This is a really interesting and unfortunate medical negligent malpractice case that awarded the individual, the patient, in this case, Jake Gleeson, a little over $20 million. So let me explain this to you. Jake Gleeson is currently age 35. At the time, he was the state of Oregon Timbers soccer goalkeeper. In our state, in the United States, we call it soccer. Other places call it football. And Jake originally, though, was from Palmerston North, New Zealand. I will put some pictures here of Jake. So the bottom line is that Jake had stress fractures. He saw the team physician, who's a board-certified orthopedic surgeon, and that surgeon performed surgery on him, which caused complications. Jake sued this physician for medical malpractice that caused the end of his career and gave him lifelong disabilities. It was a 3-week civil trial in 2018, but you know how these things take many years to get off the ground, get going, and go to trial. The jury found the orthopedic and sports medicine team physician negligent. Jake testified for 4 hours on the stand. He talked about all of the surgeries that he had to have afterwards. He talked about how it affected his life, how devastated he was, not just that this injury occurred due to negligent acts from this physician, but that he felt that the information was withheld from him and that nobody really was that sorry. We've heard this before in other medical malpractice cases, that coming clean, being transparent, and being genuine by saying how sorry you are, the surgeon, the hospital, the orthopedic team who has been in the operating room with you, instead of covering up some things or not telling you exactly what happened until after you have a devastating, life-threatening infection, that Jake found that to be inexcusable. And again, if individuals, not just in medical cases, but in general, would start with, we're really sorry this has happened, and then move to how resolution and the best way to make you whole would come next, if they would lead with that, that probably would have completely different outcomes for most of these cases. What happened? What started all of this? Jake had been diagnosed with stress fractures, and his orthopedic surgeon said the best thing that we can do for you is to put in some metal plates, bilateral stress fractures in the lower legs, and to also do a bone marrow graft. After that initial surgery and the subsequent infections and issues that occurred after that, Jake went on to have 12 more surgeries in an 8-month period, with a total of 13 surgeries. So while Jake was already sedated and in the operating room, the surgical team realized that his metal shin plates and screws were nowhere to be found. So there was a rush to find a replacement set. There was no time to properly sterilize them. Okay, so the surgeon put in what's considered dirty metal plates. Although the surgeon said, I didn't realize they weren't sterile. I thought that doing the flash 15-minute sterilization process was adequate. It's not adequate. You need the 3 to 4 hour long proper sterilization process to make sure that the patient isn't going to develop an infection. So the steam sterilization occurred. The plates and screws were then put in. And the surgeon says, if you look up some of the civil trial, the surgeon does say there's lots of other reasons he could have gotten an infection, and I can't, we can't say for sure it was because of this, but it leads to that. I mean, if something isn't thoroughly sterilized, that has a much bigger potential of the type of infection he got than, say, other things. It was for the jury to decide and weigh out, and they weighed in favor of Jake and awarded him, like I said, the $20 million. The type of infections in the lower legs that Jake developed is called osteomyelitis. I don't have details on what his treatment plan was, but usually you need more surgeries, which he did have, 13, I believe 12 more, 13 total. And you're going to need antibiotics usually for a very long time, IV antibiotics through a central line, a PIC line, that kind of a thing. It is a very lengthy process, and oftentimes people might lose a limb due to non-healing osteomyelitis. Jake talked quite a bit about how this plunged him into a hole, both physically and mentally. And it was very difficult over a long period of time for him to feel he could get out of this. Apparently, how he found out was they didn't come right to him and tell him. But after time went on and he developed these infections, I don't want to put words in his mouth, but if you listen to some of the things he says, he almost was blaming himself. What is happening here that I have these infections? And someone came to him and said, it isn't your fault. This is what really happened. And then, like I mentioned, he felt, why didn't people just come forward and tell me what was going on? After 2 days of jury deliberation, I will put up here exactly what they awarded him. I believe that the hospital settled before the trial occurred. It's not as though flash sterilization isn't used at all, but it's used in situations that are emergent life or limb, life or death emergent situations. And that is not what the case was for Jake at that time in the operating room. Putting a pause on this surgery, allowing communication to occur, talking to Jake about what was going on, what had happened, and rescheduling the surgery after proper sterilization of his metal plates would have probably been the best course of action. It's true, infections do happen, but surgical teams do everything they can to mitigate an infection or a less than favorable outcome in the operating room and post-surgery healing. Jake Gleeson is doing something completely different with his life now. His career playing soccer is over. He did win the case, but I'm sure that he wishes circumstances were different. Thank you for watching. Please consider subscribing, share this if it seems like it might interest somebody else, people who like medical malpractice cases, medical oopsies, and I'll see you at the next health video.